Welcome to an overview of the first NLN Nurse Educator Competency, Facilitate Learning. This is Mary Partouche speaking. This narrated presentation draws on the NLN Certified Nurse Educator 2015 Candidate Handbook available at nln.org. The slide headings are consistent with the 17 areas listed on the test plan for Competency 1, Facilitate Learning. This competency has the most objectives related to it as consistent with the nurse educator role of teaching. The detailed CNE blueprint contains 1E and 1F objectives related to communication. Notice that 1E emphasizes relationships with learners and 1F relates to effective communication in a variety of contexts. These objectives are combined to show illustrations that incorporate components of these objectives. Nursing specialized accreditation standards emphasize the importance of communication defined broadly. Skilled oral communication includes clear enunciation. For those who may have accents based on background, such as international students or faculty, there are programs available to reduce and modify accents. Written communication includes professional writing in all contexts, as well as writing for publication as a part of scholarly work. As you may have recognized, this crosses into a later NLN Nurse Educator competency related to scholarship. The CNE handbook includes evaluation, mentorship, and supervision as part of the 1F objective. Modeling professional thinking, communication, and behavior in all settings is a key aspect of this objective 1G. This included self-regulation and emotional intelligence, the knowledge, skills, and attitudes called KSAs of critical thinking, and the importance of modeling these to students. Benefits of high emotional intelligence may include reduced workplace stress, decreased burnout, improved clinical teaching effectiveness by faculty, increased leadership effectiveness, improved physical and psychological well-being, social relationships, and employability. Research shows that EI, emotional intelligence, helps students to achieve better clinical and academic abilities. And as defined here, the ability to perceive and regulate one's own emotions and others in a way to positively influence communication, motivation, and teamwork is part of emotional intelligence. Modeling knowledge, skills, and attitudes of critical thinking with higher level questioning fosters student reflective thinking. Disposition toward critical thinking includes the willingness to question everything by being a truth seeker, inquisitive, and open-minded. It's also the desire to give structure to thinking by being analytic and systematic, and being confident yet judicious in the face of uncertainty. Faculty can model the disposition toward critical thinking to each other, and as skill is gained, carry this into the teaching settings and modeling this to students. The previous objective focused more on modeling by the educator, and this objective focuses on strategies that will support the learning of critical thinking by students. Incorporate time for interpretation of data, charts, and graphs into class and clinical experiences to promote students' analytical thinking. Analyze diagnoses derived from deductive conclusions and show how nurses use induction to know what to assess when caring for a patient already diagnosed. I recently observed one of my practicum students teaching about arrhythmias. Her students were engaged in interpreting electrocardiogram rhythm strips, one way to increase critical thinking. In the physical or electronic classroom, unfolding case studies can engage students and foster higher level thinking. Team-based learning discussions, especially team discussion of the best answer for questions, can stimulate thinking and reasoning. Another example is during clinical experiences and when faculty uses higher level questioning when asking about drug action or lab values prior to giving medication. A survey of students showed 9 themes of faculty to student incivility: not answering questions, making disparaging comments, putting down students, scolding students in front of peers, staff, or patients, unequal treatment towards students, gender bias, racial discrimination and favoritism, and a feeling of loss of control and disrespect when faculty yelled at students. All of this is part of Miller's research survey. Students also reported justification for being uncivil if they witnessed uncivil behaviors by students and by faculty. A positive learning environment is also important in clinical settings, and staff who exhibit civil behaviors contribute positively to the learning environment. Creating a culture of respect includes training in establishing relationships that are respectful and connected, as well as respectful written communications and self-reflection. Review of clinical evaluation tools will reveal that many schools incorporate respectful civil behaviors into their evaluation of professional behaviors. So with part of that communicating respect, listening to others, giving positive feedback to students about their ideas even when they're off track, and you can do that tactfully, and answering questions even if it might be, I'll need to check and get back to you later. Showing enthusiasm for teaching, learning, and the nursing profession that inspires and motivates students. Phillips has a great chapter on engaging teaching strategies, which can make learning as well as teaching fun. Choose strategies that you enjoy teaching, given there is evidence to support their effectiveness. If you enjoy games, then use a game in your teaching, and this can reinforce concepts in a fun way. However, if games are not your thing, avoid use because it will come through somehow in your teaching and defeat the purpose of the strategy. Bring passion for and joy into your teaching and convey it through your verbal and nonverbal actions. These objectives relate to the prior 2 slides. Modeling these behaviors, identified as personal attributes in the objective, can give students confidence and contribute to an environment that feels safe for learning. It is not unusual for students to have many roles and thus need, if possible, flexibility with deadlines, assignment choices, and participation. Billings and Halstead include Watson's caring theory as a basis for educational strategies, and notice here connection to the attributes of caring, confidence, patience, integrity, respect, and flexibility. Responding effectively to unexpected events that affect instruction. A few examples of unexpected events that could disrupt teaching are severe weather, power outage, shooting, sudden illness or death, extenuating circumstances that disrupted the planned teaching. Showing flexibility was also included as an attribute in the previous 1K slide, and thus essentially having a plan B for your teaching will help with that flexibility when emergency situations come up. Develop collegial working relationships with clinical agency personnel to promote positive learning environments. Relations with colleagues should be collegial. Relationships need to be based on mutual respect, equality, and civility. And notice this comes up again here, and it comes up in various places. It's important for the nurse educator to take a leadership role in fostering a positive learning environment for students. Use joint problem solving to address problems, understanding that goals may differ, and communicate in a positive and non-emotional manner. Research has identified importance of establishing a mutually supportive relationship, ensuring a good fit between the academic unit and the clinical agency, having flexibility, and establishing a clear and open communication. Using joint problem solving to address problems and communicate in a positive and non-emotional manner. Using evidence-based practice to instruct learners. For this objective, the emphasis is on the evidence-based practice, or EBP, of teaching, also referred to as EBTP. Each of the reference books used for this PowerPoint contain evidence, or note if there is a lack of evidence for practices associated with teaching. Further research is needed on effective practices to facilitate learning. Knowledge of current practice is also a component of this objective, and there are some suggestions. Keep up to date on the ongoing changes in healthcare and subsequent changes in nursing practice. Subscribing to professional journals and listservs can alert you to changes based on evidence. It is important to model to students the importance of keeping up to date and keeping your teaching content current. Some textbooks contain a web presence to bring in new evidence. Attending workshops and conferences related to healthcare informatics in EPP will help you keep up to date. User knowledge of EPP to instruct learners in health informatics. This strategy has implications related to education and preparation of practice. Health information technology, as predicted by the Institute of Medicine, has changed in ways in which nurses provide care, and consequently nurse educators must use technology and incorporate learning related to health information technology use in clinical practice. Many schools now use a web-enhanced course approach to learning and electronic textbooks and resources. Many website guidelines grant permission to use information as long as the source is credited and it's for educational purposes. Resources may include access to evidence-based practice guidelines on the ahrq.gov website. The United States Fair Use Guidelines, including obtaining permission prior to use of copyrighted information. Given ease of accessing and transferring internet-based electronic information, it behooves the educator to be aware of policy and convey this to students. Remember, the digital natives are used to accessing information any place, anytime. Particular attention must be given to reviewing academic integrity policies related to fair use. Ease of cell phone taking of pictures and accessing social media also creates concern for HIPAA in the clinical area and has led to course clinical policies for appropriate use. demonstrates ability to teach clinical skills. Certifications require knowledge of best practices. Thus, they're important for specialty areas as well as nursing education. Certifications are renewed every 3 to 5 years, and successful renewal requires currency. Research has shown better patient outcomes and feeling of empowerment by nurses who are certified. The NLN Nurse Educator certification has led to further research in nursing education as a result of the certification. Faculty is observed by students and staff, and there are characteristics for positive role modeling: demonstration of mutual respect, beliefs and actions that are harmonious and consistent, marked commitment, and evidence of a spirit of collaboration. These will facilitate acting as a role model in practice settings. Facilitating learning is the first of the NLN Nurse Educator competencies. It also contains objectives as it is applicable to teaching and learning across settings. This competency follows the complex teaching role of the nurse educator, much of which you will be familiar with if you have taught several years or more. The following slide will have resources available that are referenced in this presentation. Thank you.